Fondaparinux, also known as Arixtra Syringe, is a medication used to treat severe blood clots in the legs and/or lungs. It is often prescribed alongside another blood thinner medication, warfarin. If left untreated, blood clots can be very dangerous and potentially lead to life-threatening conditions such as breathing problems, heart attacks, or strokes. This medication can also be used to prevent blood clots after certain surgeries, such as hip fracture, abdominal, knee, or hip replacement surgeries, which have a higher risk of blood clots. Fondaparinux is categorized as a blood thinner or anticoagulant, and it works by preventing the natural substances in the blood from causing clotting. It is important to take this medication as prescribed by your doctor and at the recommended times to ensure its effectiveness. Before you start using Fondaparinux, make sure to read the patient information leaflet from your pharmacist. This medication is given by injection under the skin of the stomach/abdomen as directed by your doctor, usually once daily. The dosage and length of treatment are based on your medical condition and response to treatment. The dosage may also be based on your weight. Use this medication regularly to get the most benefit from it. It's best to use it at the same time each day to help you remember. If you are using this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional and the product package. Always check the product visually for particles or discoloration before using it. Do not mix any other medication in the same injection. Before injecting each dose, make sure to clean the injection site with rubbing alcohol and change the injection site each time to lessen injury under the skin. If you are being treated for a blood clot, another blood thinner, warfarin, is usually started within 3 days after you start using Fondaparinux. Your doctor will direct you to use both of these medications until the warfarin is working well. Do not stop either of these medications until your doctor directs you to stop. To prevent blood clots due to surgery, your doctor may direct you to start using this medication after surgery and continue for several days. It's important to follow your doctor's directions closely and not to start this medication too soon after surgery, as it may increase the risk of serious bleeding. This medication may also be given by injection into a vein by a healthcare professional, as directed by your doctor. After using the Arixtra syringe, you may experience pain, bruising, redness, and swelling at the injection site. You may also have headaches, nausea, vomiting, swelling of the hands/feet, or fever. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist immediately. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the risk of side effects. Many people who use this medication do not experience serious side effects, but it is important to tell your doctor right away if you have any serious side effects such as easy bleeding/bruising, dark urine, or yellow eyes/skin. In rare cases, this medication may cause serious bleeding. It is important to seek medical help if you experience any signs of serious bleeding, including shortness of breath, chest pain, or severe stomach/abdominal pain. It is important to also get medical help if you experience a very serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, it is important to contact your doctor or pharmacist. If you experience any side effects, you should seek medical advice. If you are prescribed Arixtra syringe, it's important to be aware of the potential risks and benefits. This medication may increase the risk of bleeding near the spinal cord after certain spinal procedures, which could lead to long-lasting or permanent paralysis. It's crucial to discuss these risks with your doctor before undergoing any spinal procedures. Your doctor may instruct you to stop taking Arixtra for a specific period of time before and after the procedure, so be sure to follow their guidance closely. The risk of bleeding may be higher if you have a deformed spine, a history of spinal procedures or surgery, or if you are taking other medications that can increase bleeding or bruising. These medications may include antiplatelet drugs, blood thinners, or nonsteroidal anti-inflammatory drugs. If you experience symptoms such as back pain, leg numbness, weakness, or loss of control of the bowels or bladder, it's important to seek medical attention immediately. As for the daily dosage and optimal timing of Arixtra syringe, always follow your doctor's instructions and never adjust your dosage without consulting them first. This medication is typically administered as a subcutaneous injection once daily, and the best time to take it may vary depending on your individual medical needs. Be sure to discuss the optimal timing with your doctor to ensure the most effective and safe use of Arixtra Syringe. Before using Arixtra Syringe, it is important to inform your doctor or pharmacist if you have any allergies, especially to natural rubber/latex. This is because the product may contain inactive ingredients that can cause allergic reactions or other problems. It is also important to provide your medical history to your doctor or pharmacist, especially if you have a history of certain health conditions such as heart infection, bleeding problems, high blood pressure, kidney disease, seizures, or recent surgeries. Additionally, it is essential to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products before undergoing surgery. While taking Arixtra Syringe, it is advisable to limit alcohol consumption to reduce the risk of stomach bleeding. Caution should also be exercised to avoid getting cut, bruised, or injured, especially among older adults who may be more sensitive to the drug's side effects. For pregnant women, the use of this medication should be carefully considered and discussed with a doctor, and for breastfeeding mothers, it is recommended to consult a doctor before using Arixtra Syringe. It's important to be aware of potential drug interactions with Arixtra Syringe. Certain medications can change how Arixtra works or increase the risk of serious side effects. Make sure to keep a list of all the medications you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Arixtra include mifepristone and other drugs that can cause bleeding or bruising, such as antiplatelet drugs like clopidogrel, NSAIDs like ketorolac, and blood thinners like rivaroxaban. Be sure to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers and fever reducers that can increase the risk of bleeding when used with Arixtra. However, if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless instructed otherwise. If you have any questions, ask your doctor or pharmacist for more details. If you or someone else has taken too much Arixtra and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222. For Canada residents, contact a provincial poison control center. Signs of an overdose may include excessive bleeding and bruising. Always take Arixtra as directed by your healthcare provider to avoid any risk of overdose. This medication should not be shared with others. It is important to have regular lab and medical tests while using this medication, such as a complete blood count and kidney function tests. Make sure to keep all medical and lab appointments, and consult your doctor for more details. If you forget to take a dose of Arixtra, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and take the next dose as scheduled. Do not take a double dose to make up for the missed one. It's important to take Arixtra as prescribed by your doctor to ensure its effectiveness. When storing Arixtra Syringe, make sure to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. Each pre-filled syringe should only be used once, and any unused portion should be discarded. Do not flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.